All right, what do you think, Michelle? Should we go ahead and get started?
Yes, let's go.
All right, well, good morning, everyone, and thank you for joining us for the September New Employee Orientation. I'm Mandy Kenzie. I'm with the Bureau of Human Resources. I also have Jade Milley on with me. We are both human resource generalists in BHR, and we are going to just talk a little bit about the basics of BHR. We're going to do the first part of the presentation, and then we have some other folks from HR on with the meeting as well, and they will talk about some of the other areas of HR. So our goal today is just to give you an overview of BHR, answer questions that have probably come up regarding your employment or benefits with the state of South Dakota. If you have questions as we go through, feel free to click on the Q&A button at the bottom of your screen. We will answer questions at the end of each section, but feel free to ask a question at any time. If you think of a question after the presentation, Michelle's email address is listed, and you can just feel free to shoot her the email and she will forward it to the appropriate person. You don't have to remember which of us spoke about which topic. She'll take care of all that for you. So we just want to make sure that your questions are answered and to give you an easy way to filter those questions. The Bureau of Human Resources, our mission is to build, develop, and support a high-performing and healthy workforce. I feel like we're just all so passionate about human resources and what we do and providing support to all of you, to the supervisors and managers. So I get a little excited. I'm kind of nerdy that way when it comes to talking about human resources. And the first thing that everybody wants to know is when we get paid and how we get paid and all of that fun stuff. So our pay periods end on the 8th and the 23rd of every month. And our pay days are on the 1st and the 16th of every month. If the payday falls on a weekend or a holiday, then it is moved to the Friday before. There's a couple of exceptions to that, and that's in January and July. If it falls on the 1st, the payday is the following Monday, so it could be on the 2nd or the 3rd. So it just kind of depends, but January and July are the two exceptions to that. Also, I want to point out that it's very important that your timesheet is correct, and here's why. If something happens and you're overpaid, we have to completely void your direct deposit and withdraw it from your account. And then we can't do another corrected paycheck for a few days later when we run, it's called a correction run. So I just want to point that out. It is just so important that you double check your timesheet. Don't always rely on your supervisor to double check that. They're busy and sometimes they get in a hurry and they just want to get it approved so that it can get off to HR so that you can get paid. I also want to point out to you that your work week may begin on a Thursday, it may begin on a Friday, and it may begin on a Saturday. Each agency is kind of a little bit different. So I would encourage you to visit with your supervisor or your human resource specialist to make sure you understand when your work week begins. And then if you have to adjust any hours, you can make sure that you're doing it in the correct week. I've had situations where an employee didn't know when their work week began and they thought that they were work adjusting appropriately. And what actually happened is they had to use vacation leave for 1 week, and then they got overtime for the next week. So I just ask that you visit with your supervisor, your human resource specialist. Just make sure that you know when your work week begins to keep us all on the same page. As far as overtime, that's for hourly employees only. It's based on your actual hours worked, and it's hours over 40. So if you have vacation leave or sick leave, or if there's any holidays or admin days within that work week, those hours do not count towards overtime pay. And again, feel free to reach out to HR if you have questions about your work week or overtime or any of that kind of stuff. We're here to help you. And speaking of timesheets, hopefully your supervisor has shown you the TKS system, the state's timekeeping system. We call it TKS. So this is your login screen. This is what you're going to see the very first time. This is where you are going to log your hours on a daily basis. You're going to enter leave slips, and on the next screen, I'm going to show you what that looks like once you get signed in. This is just kind of a generic time form, and yours might look a little bit different, but for the most part, it's going to have your name and your employee number, your position number, and it's going to have your leave balances on it as well. I would also suggest that you track your leave balances in your portal and not necessarily rely on the TKS system for the totals. Just depending on the timing of it, they can be different. So just I just wanted to point out that there's two different places where you can check your leave balances. You can see over on the left-hand side, there's hours worked, there's admin, and then you can see where it says human resources. That's a time study. Some of you will have time study codes and some of you won't. So each area is different. Some of you will have comments boxes in your TKS and some of you won't. So just totally depends on the agency and the division within the agency. If you want to look at a different work week or work period, you click on that retrieve button that's in the middle and you can select your different work weeks. The second button over is the leave button. So that's if you want to submit a leave request. And you can see down on the bottom of the screen what it looks like once you click on that leave button. You click on the leave type, that's a drop-down menu. So you can pick vacation leave or sick leave, and then you enter the hours for that appropriate day. When you do that, it automatically sends an email to your supervisor so that they know that you have submitted a leave request and they have to go in and approve that. Now, vacation leave has to be pre-approved. So you want to enter that in as soon as you know. And then of course, if sick leave, if it's a doctor's appointment, something that you know about ahead of time, you can go ahead and enter that in at any time. But if you're sick today and you enter in your sick leave notification tomorrow, that's okay too. So the third box over is the inconvenience pay. Some positions are able to get inconvenience pay. So you'll want to visit with your supervisor to know if that's something that you qualify for or not. Not all positions have it, but some do. And then you can see the print button if you want to print your timesheet. The save, if you enter in your hours that you worked, you'll want to hit the save button. And then the sign button is where, when you know that your work period is complete, all your hours are entered and accurate, you'll hit sign. Your supervisor will also go in then and sign your timesheet. Once it's all submitted, then the HRS is going to go in and sign your timesheet. So there's going to be 3 different signatures on your timesheet. It's also important to note that if you're a salaried employee, you have to take leave in 8-hour increments. You don't do partial day increments for leave. Oh, and I was going to also point out that certain positions are able to bank their holidays. So if you are working in a division and you have to work on a holiday, you can choose to bank that holiday, and you can see where it keeps track of that banked holiday kind of in the middle of the screen there. And then you have 60 days to use that banked holiday, or you can choose to go ahead and leave it on your timesheet and get paid for it and get paid for the hours worked. So that's a nice little perk, nice option that you have. On the next screen is the probationary period, and that's 6 months for most positions. During that time, you should have 2 performance evaluations, one at 3 months and one at 5 months. And this is so important for new employees to understand how they're going to be graded, how their performance is going to be evaluated. So if your supervisor hasn't said anything to you yet about your probationary period or your evaluation, I would ask them to see just a generic form so that you know exactly what's expected of you, so that you know how you're going to be graded or what you're going to be graded on. This is a time for supervisors and employees to make sure that the job is compatible, that you're a good fit for the job. When you're a probationary employee, you can be dismissed during that probationary period at any time. So I just strongly encourage all of you to just check with your supervisor and ask them if you can see a copy of that form. I think our slides might have gotten a little bit out of order here. Vacation leave, which we had kind of talked about earlier, it's accrued at 5 hours per pay period for a maximum of 240 hours, so it caps out. Once you've been here for 15 years or longer, you earn 6.6667 per pay period for a maximum of 320 hours. If you're a part-time employee, that leave is prorated based on the number of hours that you work. And sick leave, permanent full-time employees earn 4.666 hours of sick leave per pay period, and there is no maximum. And again, for part-time employees, that leave is prorated. You might have heard your coworkers talking about, or maybe you've heard it through media, that the state has done away with personal leave and that you can use your sick leave for more options. And that's just awesome. That really allows people to take advantage of their sick leave usage and not be capped at those 40 hours. So if whatever your sick leave balance is in your bank, you can use it for yourself or for the temporary care of immediate family members. So a personal illness, or maybe it's vision or dental or medical appointments, or birth or adoption of a child, temporary care of immediate family member. You can see the reasons listed there. I want to talk a little bit about our bereavement policy. You get 5 days of your sick leave to use towards bereavement per death. So that is an excellent benefit that the state offers as well. So I'm going to stop there, and Jade is going to take over, and she's going to talk about some more leave options that are just awesome benefits that the state offers. Again, if you have questions, feel free to use that Q&A box at the bottom of the screen there, and we'll answer them as we can. So Jade, it's all yours.
Hi, everyone. Like Mandy had said, I'm a human resource generalist as well. I'll be covering the second portion of our presentation for about the human resource services. The paid family leave is a new benefit for state employees. This benefit provides eligible employees with paid leave following the birth or placement of a child for adoption. The PFL is intended to help provide parents with the means to spend critical bonding time with the child. A permanent employee is eligible if they've been employed with us for a minimum of 6 continuous months. They are eligible up to 24 hours per week for up to 8 weeks for this benefit. Part-time employees would receive it at a prorated basis. And with supplementing the remainder of your hours, you're able to utilize sick or vacation leave during the work week. The paid family leave must be taken within 1 year of the birth of a child or adoption. And the paid family leave must be taken in full week increments. Any hours of paid family leave not used during the week the employee takes will be lost. The Family Medical Leave Act, it's commonly referred to as FMLA, provides eligible employees with up to 12 weeks of unpaid job protected family and medical leave each year for certain family and medical reasons. Employees are eligible if they have worked for at least 12 months and have at least 1,250 hours of service during the 12-month period immediately before the start of the FMLA leave. The FMLA leave is not an extra bank of leave, and if you are going to be out for longer than 3 days due to a serious medical condition or any events on that sort, please notify your supervisor and your HRS. Next, the military training leave. Permanent employees are entitled to military training leave up to 15 days per calendar year. Employees requesting military leave for training must obtain written order from the commander of the Reserve and National Guard unit indicating dates of the training period. This notice is to be submitted to the supervisor at least 15 calendar days prior to the departure for training. The longevity pay is a reward for years of service to the state of South Dakota. It is a way to recognize experienced and dedicated state employees. The longevity pay is based on the total number of years worked for the state. As for example, on your screen where from 7 to 10 years of service, you receive a $100 longevity payment each year. From 11 to 14 years, you multiply that by $10 per year. Multiply by 10 by years of service, and then for years of 15 to 19, multiply 15 by years of service. The years of service need not be continuous. If you have previous service that might affect your longevity date, say you did work study for one of the state of South Dakota's universities and that sort of thing, that would count towards your longevity, and we encourage you to reach out to the human resource specialist. The state grants 10 paid holidays annually. If a holiday from the list falls on a Saturday, the preceding Friday is observed as the paid holiday. If a holiday falls on a Sunday, it is observed on the following Monday. Holiday pay is prorated based on hours worked for employees who are working less than full time. If for some reason you work on a holiday, you'll get paid your holiday hours plus your hours worked. The HR portal allows employees to take an active role in maintaining some of their information in the payroll system. For example, you can update your home address, emergency contacts, federal tax withholding, and the direct deposit information. With our system, you'll need to access it through Chrome. It is not compatible with Internet Explorer. And if you're needing any assistance, please reach out to BHR, or there's also user guides available at the BHR website. And then when you access the site, this is a single login. You'll access it entering your state email address, and your password would be the same as your computer network password. And then on employees, this is where when you log in, this will be the main screen that you'll view. And from this screen, you're able to access like viewing job opportunities within state government, edit your profile, your direct deposit view, your earning statements, and your leave balances like Mandy had mentioned earlier. This is where you go to see all of this and be able to make updates yourself. The Accountability and Competency Evaluation, commonly known as ACEs, is the comprehensive performance management system that improves the quality and performance communication between supervisors and the employee. The accountability is based on your performance of duties, and the competencies is the relative abilities, knowledge, and skills that enable a person to perform effectively in their position. Your supervisor should have already gone over the ACE document with you. If not, please discuss it with them. They'll outline what they'd be evaluating you on and be able to answer any questions about the form. The ACEs, on the ACEs, we use a rating system of unsatisfactory, improvement, development needed, successful performance, and exceptional performance. And workers' compensation, if you are injured on the job, it's important to fill out a first report of injury, or commonly referred as a FROI, ASAP. Policy states that you have 3 days to report an injury on the job to your supervisor and 7 days to complete a FROI. Next screen, please. This is a screenshot of what the first report of injury looks like. Everything that you enter must be completed accurately, and also all the fields have to be completed before you'll be able to submit the form. This report determines workers' comp eligibility in situations where you must go to the hospital, so it is important to be detailed and precise with the information, and it gives our workers' comp staff the information necessary to kind of start reviewing the information of what had happened, and then also for you to have a copy of it to know what happened, be able to give the details to your supervisor, and then also the same information you'd relay to your doctor of the injury. Next, I'm gonna pass it off to Kim Buck with our benefits division.
Good morning. I hope everyone's doing well. As Jade said, I'm Kim Buck. I'm the Assistant Director of Benefits with the state of South Dakota. And what we're going to do today is just go over some of your benefits. We're going to talk about health insurance, life insurance, flexible benefits, which are dental, vision, those types of things, account-based plans, and then Carrie Singer, who is our wellness coordinator, will be joining us to talk about the benefit wellbeing program and our employee assistance programs. Next slide, please. So this is a screenshot of the benefits website, benefits webpage. As you can see, the goal of the state of South Dakota Benefits Employee Program is to offer quality, affordable health care and flexible benefits options. When combined with the benefit wellbeing program, you as a state employee have all the resources and options necessary to make informed health care decisions and healthier life choices. I also want to point out that this BHR benefits site offers you a wealth of information and is a great resource for you as an employee, whether you're a new hire or an ongoing employee. It includes forms and documents, contact information for our third-party administrators, descriptions of the different benefit plans, compliance documents, just basically anything you as a state employee would want to know about your benefits. Contains all kinds of helpful links. Next slide, please. So it's really important to note that you have 30 days to enroll for your benefits. That's 30 days from your start date. So if today is your start date, September 16th, you have until October 15th to get enrolled for those benefits. If you miss the deadline, you will be defaulted into the high deductible health plan. You cannot elect any flexible benefits. And importantly, you can't add any family members to the health plan or flexible benefits. Once you complete that initial enrollment period, it's important to note that the only time you can make changes to your benefits is if you have a qualified life event, which would be defined as you get married, you get divorced, you have a child, maybe you have coverage through another plan and you lose that coverage. Those are qualified life events. Or during our annual enrollment period, which begins, which is in early May. So it's quite a while to annual enrollment. It's also important to note that our plan here runs from July 1st through June 30th. So again, as you're making those benefit decisions as a new hire, please keep in mind that this is your first opportunity and really your only opportunity unless you have a qualifying life event or during annual enrollment to make those decisions. So make sure you choose what's best for you and your family situation. Next slide, please. So a nice benefit with the state of South Dakota is there is no premium cost for the employee-only health plan. However, if you elect to add your spouse or any other qualified dependent, premiums are paid by you through a pre-tax payroll deduction from your paycheck. Flexible benefits are also paid by deduction from your pay. So to reiterate, if it's only you on the health plan, you're not going to be paying any premiums. Any other dependents or additional optional benefits that you choose will be paid by you through your paycheck. Next slide. So effective coverage dates. The employee health plan is effective from 1 month and 1 day from your date of hire. So again, like today, if today your hire date is September 16th, your benefits will become effective October 17th. I'm doing this without a calendar, so I'm doing this in my head. So it's 1 month and 1 day from your date of hire. Your employee and dependable flexible benefits as well as dependent health plan are effective either the same day or is based on the first payroll deduction date. So that gets a little confusing, but what that means is that depending on the time you enroll for your benefits, say you wait till October 11th to enroll for your benefits, you may have to make catch-up premiums out of your payroll to make sure your health coverage is in effect. The reason for that is we actually pay our premiums 1 month in advance. So if you're a new employee and you've already enrolled, you'll see those deductions on your first pay stub and you'll be like, well, my benefits aren't effective yet. That's because we pay for 1 month in advance. Subsequently, if you leave the state of South Dakota, which we hope no one does, your benefits will then continue for 30 days after your termination date. So that's why we pay those in advance. Next slide, please. So how do you enroll? And there, I should probably switch these screens around, but you have to register. You must create an account. You have to confirm your elections, and you have to print your confirmation statement. Next slide, please. So this is the screenshot on how to create a new account. If you're using a personal email address, just remember that it may not be accessible from within the state network. So a lot of people do use their state email address as the registration device. Then you create a separate username and a separate password and click on the CAPTCHA below so that we know you're not a robot. Please make note of your username and password as we do not have access to your password information, and therefore we cannot reset that or retrieve that. You would have to do that yourself. Also really important to notice, make sure you're aware of what email address you're using when you register. If for some reason you do forget your password or even your username, you can request that information by submitting a request for that, and it will go to the email that you registered with. Next slide, please. So as you're going through enrollment, there is a lot of helpful tools and resources to help you decide which benefits are best for you. As I said, with regards to this presentation, we're going to give a really high-level overview because I could spend 2 days going over our benefits. But available online is a decision guide. The decision guide outlines each benefit offered through the benefits program. You should have received one in your new employee folder, but it is also available on the benefits website. Then there's also Alex. Alex is an easy-to-use interactive online tool. It offers benefit recommendations based on your personal situation. However, it's important to know that Alex is only a tool, and it's up to you to make the decision that feels right for you. Alex is also not part of our enrollment system. So if you go through Alex and he makes his recommendations, you are not enrolled for benefits at that time. It's simply a decision helping tool. And then of course, if you have any questions, please reach out to one of our benefits specialists, and our phone number is listed there at the bottom of the screen, 605-773-6027. This will be recorded and posted to our website. So if you didn't have time to write down any of these numbers, this information is available on our website as well. Next slide, please. So now we're going to talk about some of the health plan options. There's 2 options available. There's a low deductible health plan with an optional flexible spending account. And we'll go over those accounts later on. We also have a high deductible plan with an optional health savings account as well. You can also opt out with proof of other group coverage. Group coverage is considered Medicare, TRICARE, or other coverage through another group plan or private provider. VA services and Medicaid are not considered group coverage within the parameter of the state plan. However, it's important to note that those opt-out regulations apply to employees only. So if for some reason you're married and your spouse gets VA services, you certainly do not have to enroll them in the health plan. Same if you have any dependent children. If they have VA services or Medicaid, you're not required to enroll them in the plan. These rules apply only to employee-only coverage. Next slide, please. So with regards to the low deductible health plan, there's a $1,500 deductible for single coverage or a $3,750 combined deductible for a family of 3 or more. So as you can see from the little people at the bottom of the screen, $1,500 is one person. If it's you and one eligible dependent, that deductible is $3,000. And then finally, if you have a family of 3 or more, that deductible is $3,750. Once you satisfy the deductible, the plan will cover eligible expenses at 75%, and members are responsible for 25% coinsurance until you reach your out-of-pocket maximum. Again, this is really high level, so as you're making your decisions, please research Alex. Next slide, please. With the prescription coverage on the low deductible health plan, there is a separate deductible and a separate out-of-pocket maximum. So for prescriptions, you also have deductible co-payment, which is a flat dollar amount, applies after the deductible is met. The out-of-pocket maximum for prescription coverage is $1,500 per person or $3,750 for a family of 3 or more. The co-payment amount on the prescriptions, depending on what type of prescription it is, can range from $15 to $110 for a 30-day supply. Next slide, please. We also offer a high deductible health plan. The high deductible health plan, there is a deductible if you have single coverage, or a $4,400 deductible for a family of 2 or more. If you have a family of 2 or more, you must satisfy the $4,400 family deductible before any benefits are paid. Once you've satisfied that deductible, the plan will cover eligible expenses at 75%, and then you are responsible for the 25% coinsurance amount up until the out-of-pocket maximum is reached. Next slide, please. The difference, one of the major differences between the high deductible and the low deductible health plan is that there is no separate deductible for prescriptions on the high deductible health plan. So prescription costs also coordinate with your healthcare costs and apply towards your additionally, under the high deductible health plan, there is a preventive therapy list. These can be covered, and you would have to look on our website, but these are covered at a reduced cost prior to satisfying your deductible. So certain generic maintenance drugs may be a $0 copay or coinsurance if they're on that preventive therapy list. Next slide, please. Under both of the health plans, eligible preventative care is covered at 100% when age and frequency requirements are met. So this includes well child care, an annual wellness preventive exam, cancer screening procedures, pregnancy care preventive screenings. We have a program called Our Healthy Baby, which Carrie Singer will go over in more detail later on in this presentation, and then scheduled immunizations and vaccinations. So again, when let's say you're going to your annual preventive exam and or you have to have a mammogram done, you do not have to meet your deductible. That's automatically going to be paid at 100%. Next slide, please. So we're going to, again, talk at a high level about dental, vision, accident, hospital indemnity, our short-term disability plan, and supplemental life insurance. So the state partners with Delta Dental of South Dakota. There are 2 plans offered. There is a base plan and an enhanced plan. Both cover the same services at different levels. So for example, routine exams on the base plan are covered at 75%, but if you are in the enhanced plan, those are covered at 100%. Of course, you'll see a difference in premium between the two just based off the level of coverage that you need to have. The nice thing that happened is as of July 1st, 2020, if you've had dental coverage before, you know, if you go to get your cleaning, that amount applies towards the annual maximum that Delta Dental will pay. As of July 1st, preventative services do not count towards your annual maximum. So if you go to get cleanings done and then you have to go get a root canal done, your preventive services, those cleanings, x-rays, etc., are not going to count towards that annual maximum. So you'll actually get more coverage throughout the plan year. Again, detailed information is offered in the decision guide on each of these plans. We also have vision care through iMed. Covered services include exams, frames, lenses, and contact lenses. As I said, our plan year runs from July 1st through June 30th. So there is a set amount of items that are covered in each plan year, but eligibility for those services reset July 1st of each plan year. With all of our benefits, you should see an in-network provider to receive the highest level of benefit. On a side note here, I'd like to say real quick, in Peer, we have no in-network optometrists. They are just will not participate in our in-network program. However, because we do not have any in-network optometrists within a 50-mile radius, if you go see an optometrist in Peer, you would pay for that out of pocket and submit a reimbursement form. You will then be reimbursed at the in-network rate for things such as exams. Next slide, please. So MetLife is our partner. They provide supplemental coverage for accident, hospital indemnity, short-term disability, and supplemental life. This coverage is separate from any of your other elected benefits with the exception of short-term disability and do not coordinate benefits. So again, there's an accident plan which covers accidents, accidental injuries on or off the job, hospital indemnity, which pays you a certain amount if you choose to enroll for hospital stays. There's supplemental life. So the state of South Dakota, for all employees, regardless of whether you enroll in our benefits or not, are automatically provided with a $25,000 life insurance benefit. You can purchase up on your supplemental life. And the amount you choose is based on your needs. But you can purchase additional supplemental life over and above what the state provides. And then there's short-term disability. Now, short-term disability, I want to point out, does coordinate with any payments that the state may provide to you. So if you enroll in short-term disability and say 9 months from now you have a child and you take part of that paid family leave, short-term disability will offset what you are receiving with paid family leave. That also applies to workers' compensation. So again, that's something to think about as you enroll. Additionally, with short-term disability, if you enroll for benefits and let's say you're eligible October 1st, with short-term disability, there is a 6-month wait period before you can collect any disability benefits. Again, refer to the decision guide as you go through that. Next slide, please. Okay, account-based plans. These can get a little confusing, so I'll try to go over those, hopefully explain them in a way that makes them a little more understandable. But we offer a health savings account, which is available with the low deductible health plan. We offer FSAs, which are also available. There's a dependent daycare flex spending account. Note that you can enroll in this even if you're not in our other plans. There's a medical flexible spending account, a combination FSA, and then a health reimbursement account. Next slide, please. So a health savings account, again, is only available with the high deductible health plan. There's 2 forms of contribution. There's the state contribution. The state will make a contribution to your plan. If you are a single employee, the state will make a $500 contribution to your plan. If you have a family of 2 or more, that amount is $1,000. And then you can make personal contributions as well. You can do pre-tax payroll contributions if you elect to do so. These accounts help you pay for covered medical, dental, and vision expenses with pre-tax dollars. The money in an HSA is always yours. So the state money and your own money is always yours. So it rolls over from year to year. If you leave employment with the state, you don't lose it. So it's a really great savings vehicle if you go with the high deductible health plan. There are IRS maximum contribution limits, which are outlined in the decision guide. The nice thing also about the HSA is you can change your payroll contribution at any time in the plan year. So let's say you initially elect to have $100 in there, and then you realize you need glasses or dental work, you can increase that amount by filling out a form that is available on there. So you can increase it, decrease it, or stop those deductions at any time. Next slide, please. It's important to note, to check if you are eligible for an HSA account. The state does not monitor that. That is your responsibility. So it's important to note that you may not be eligible for an HSA if you are covered by another health plan that is not a qualified high deductible health plan. If you're covered by TRICARE, if you're dependent on someone's tax return, or if you're signed up for any part of Medicare coverage, including Part A or B. Also, if you have a spouse contributing to a medical FSA, you may not be eligible to participate in HSA. Next slide, please. With a health savings account, and I'm sorry, let me just say, if you're not sure if you're eligible, you can consult with your tax provider and they'd be able to let you know that. With the health savings account, if you enroll for that, you must activate your account. And I would say generally give it about 30 days after you enroll because they do have to receive eligibility files. But you would go to discoverybenefits.com, create your username and password, and sign in and accept the terms and conditions. I'm stressing that you have to sign in and accept the terms and conditions because until you do this portion of it, the state nor you can contribute any dollars to your health savings account until you do that. That is an IRS/federal regulation. So if you sign up and 2 months from now, you're like, I don't have any money, my HSA, where's my contribution? It's probably because you didn't go in and activate your account and accept the terms and conditions. Next slide, please. And I will address any questions we have after my section of the presentation. So we also have a medical flexible spending account as well. Only you contribute to this account. There's not an employer contribution. This also helps you pay for out-of-pocket medical, prescription, dental, or vision expenses with pre-tax dollars. So if you, let's say you sign up for the low deductible health plan, this might be something you would want to think about for saving money for those out-of-pocket expenses. The important thing with this medical flexible account versus an HSA is it's a use it or lose it account. So let's say you set aside $500 and you use none of those dollars, and now it's September 14th of the next year. If you do not use that money, you forfeit it. So it's really important to budget for the amount that you need. Again, that's not a South Dakota law, that's an IRS regulation. You do have through September 14th of each plan year to incur expenses. So for example, July 9th, say you started July 1st, 2019, which nobody here did because it's a new employee, but you start July 1st, 2019, you have until September 14th of 2020 to incur expenses, and then expenses must be submitted by October 14th. See a little bold there at the bottom. If you're on a high deductible and have a health savings account and elect to have a medical FSA, it can only be used for dental and vision expenses until you've met your deductible. So again, just some important things to remember. It's a lot of information to take in, but our benefit specialists are always available to answer any questions you have. Next slide, please. You can participate in a medical flexible spending account even if you're not on our health plan. You can also use the dollars for, and that applies to the HSA as well, but you can use the dollars you contribute for any eligible family member. So let's say you're enrolled in our low deductible health plan, you elect a medical flexible spending account, but your spouse is, or dependent children are on a different plan, you can still use those FSA dollars for their expenses. If you leave employment with the state, you have 60 days to submit the claim, and the claim must have been incurred while you have active benefits. Next slide, please. With a medical flexible spending account, as with all of these accounts, there is IRS maximum contribution. Again, with a medical FSA, once you make an election amount, you can only change it during annual enrollment or due to a qualified life event. Next slide, please. We also offer a dependent care flexible spending account. This allows you to set aside pre-tax dollars for dependent care expenses. This is not for dependent health care costs. This is strictly for daycare expenses. So I've had people in the past who enroll for it and they thought it was because maybe their child's getting braces and I need that extra $5,000. It's not for that. It's strictly for daycare expenses. The same rules as apply with a medical FSA. It is a use it or lose it account. The IRS maximum contribution is $5,000 per household. So it's important to make note of that too, because if you're contributing to a dependent care FSA and then your spouse elects to contribute to a dependent care FSA, you will probably be dinged by the IRS when it comes time to file your taxes. Next slide, please. So this one's a little confusing, but it's a combination FSA. So basically, if you were enrolled in the high deductible health plan and you have a health savings account, and then you select to have a medical flexible spending account, the flexible spending account can only become what's called a combination FSA. If this pertains to you, you can only use it for dental and vision expenses until you reach your health plan deductible. Once you reach your deductible, you would have to submit a form to Discovery Benefits, who administers all these account-based plans for us to access the funds for medical or prescription expenses. Next slide, please. And now we have a health reimbursement account. And I promise you this is the last of those accounts. There's an HRA. If you are in the low, if you're in any of the plans, the low deductible or the high deductible plan, sorry, I need to change up that slide, and participated in our Healthy Baby program, which again will be gone over in more detail later, the state will contribute up to $500 into an HRA account. These funds can be used for medical, prescription, dental, and vision expenses. Additionally, if you choose to opt out of the health plan because you have that other credible coverage, you can also receive up to $300 in that health reimbursement account. If you're in a combination HRA, these funds are limited to dental and vision expenses until you satisfy your deductible. The difference with it, the one thing that's really important to point out on these HRA accounts is these are non-contributory accounts on your part. So the only way you're going to get an HRA account and money in that is from the state is if you participate in our Healthy Baby or you opt out of the health plan. With regards to the opt out of the health plan, it says you receive $300. The exception to that is if you opt out due to Medicare. The federal regulations prohibit anyone from, prohibit the state and any other entity from contributing to a HRA because you've opted out due to Medicare. Next slide, please. So this is a slide for Discovery Benefits. As I stated, they are the ones that administer all of these other accounts. Their phone number is listed here. They're also available on the website. If you enroll, you'll automatically receive a Visa card that can be used, at your provider to pay your prescription costs, etc. It's important to note that just because you receive the card doesn't mean you've gone on and accepted those terms and conditions. So you'll get the card even if you haven't accepted the terms and conditions yet. So again, make sure you do that. All of this information is also on the BHR website. Next slide, please. Last but certainly not least important is dependent verification by a partner that we have called Dialogue Direct. If you add a spouse and or children to the health plan or any of our flexible benefits, you will receive information from Dialogue Direct within about 30 to 60 days asking you to verify their eligibility. If you do not complete this process, your spouse and or eligible dependents will be dropped from your health plan and flexible benefits, and you will not be allowed to re-enroll them at a later date. They would just be dropped. Then you would have to wait for annual enrollment or a qualified life event to re-enroll them. And again, then you would receive dependent verification by Dialogue Direct. So again, watch your mail. This comes in the mail. Very, very, very important to make sure you do your dependent verification. Next slide, please. So this about wraps up my section of the presentation. I see we do have some questions, but I just wanted to make note that if you have any questions about benefits after the presentation concludes, or at any time, please call our benefits line at the number there, or you can email benefits website at state.sd.us. I'd like to answer these few questions here real quick, Michelle, if that's okay.
Sounds good.
Okay, so the first question we have, I'm just going to go ahead and answer these live. It says, how do you find the in-network providers for each plan, dental, vision, healthcare? If you utilize the decision guide, there will be links on each one of those pages. Additionally, there are links available on our website. So you go to the BHR Benefits website, look at that provider, whether it's dental, vision, etc. You'll be able to click on links and find those in-network providers. So we have another one. Just to make sure I'm understanding this correctly, if I only have the basic dental plan, therefore getting 75% coverage, I can use the HSA to pay whatever is left from that dental appointment. That is correct. So yes, that HSA is available for dental, vision, prescription, or medical benefits. So another question, since we don't lose state added HSA funds, does that mean that we have whatever's left over from this year plus 500 for the next year if we enroll in the same HSA plan? That would be correct depending on the amount. The amount of the state contribution to the HSA is always subject to change, but let's say hypothetically it's $500 next year as well. If you have $500 in your account this year and next year it's still a $500 state contribution, that's correct. You would then have $1,000 in that plan. It always rolls over. Where do we enroll for benefits at? I'm sorry, I might have missed that part. If you go to the benefits website at the beginning, and again, this will all be posted, the bhr.sd.gov, there's a link that says employees. And then when you click on that, you'll see new employee enrollment. That's where you would do the enrollment at. Is there a list that tells who qualifies for a dependent? There is. That's a little, I mean, it would be a spouse. It would be a dependent child under the age of 26 or up to age 29 if they are enrolled full-time as a college student, and you would have to provide verification of that enrollment. Adopted children, stepchildren, if you're a legal guardian of a child and can provide proof of that, and you're required to have coverage on that child, that would be a dependent as well. And I hope that helps. Will we have an insurance card that we take with us to the appointments, or will the providers look us up in the system to verify coverage? You would receive an insurance card for medical, dental, and vision. If you enroll for any of the other benefits such as supplemental life or accident, then you would just file a claim. You wouldn't receive that, but you should receive an insurance card for medical, dental, and vision. Plus, if you enroll in any sort of those account-based plans, you will get a credit card or that Visa card from Discovery Benefits. So it looks like we've answered all of those questions. Thank you everyone for listening to me talk here for the past half an hour, maybe a little bit longer. Welcome to the state of South Dakota. And again, please don't hesitate to reach out to us if you have any questions. I am going to turn it over to Carrie Singer now.
Good morning, this is Carrie Sanger, and I'm your Employee Wellness Coordinator for the state of South Dakota. I know you've covered a lot of information in this first hour, so hopefully you have an opportunity to learn a little bit more. Your Benefit Wellbeing Program is provided to all state employees and their covered spouses. And our theme for today, or our topics for today, are just provide an overview of the Wellbeing Program. We'll discuss what the incentive is for participating, the qualifications for earning the incentive, health screening options, the benefit portal, and the Employee Assistance Program. So why support employee well-being? Most all companies, agencies across the United States have some type of employee well-being program. And the reasons are listed on your screen. It really can affect your employee relations and morale, reduce absenteeism, enhance recruitment and retention, and lower healthcare costs, not only for the self-insured state health plan, but also your own personal costs. So those are some good reasons why we have an employee well-being program. The governor and others in the state are very supportive of the program, and we encourage you to learn as much about it as you can during this presentation and participate. In order to provide a broad range of well-being programs for you and your covered spouse, we work with a variety of vendors. So 3 of those vendors are listed on this screen: Staywell, Health Management Partners, and KeyPro. Those 3 vendors will work together to provide a variety of program opportunities and resources. And you'll want to kind of make a mental note of those vendor names. So if you get an email from Staywell or Health Management Partners, or you receive a call or information, you know that is one of our valid vendors that the state of South Dakota works with. So what are the well-being opportunities that we have available? We offer health screening to all of our state employees. We offer lifestyle health coaching, conditions management programs. We have a brand new and approved wellness portal, and we have lots of opportunities for learning and challenges to keep you motivated. Now, because these programs can be great programs, but sometimes it's difficult to encourage people to participate. A lot of us know what it is that we need to do to be healthier and improve our well-being, but sometimes we need a little motivation to actually participate. So we always offer an incentive to participate in the well-being program. Historically, the incentive was tied to the health plan selection. So for employees that have been with us for a while this year, if they completed the well-being qualifications, they would have access to the low deductible, or if they chose the high deductible, they would receive a health savings account contribution. And at this time, as a new employee, the only way you can receive a health savings account contribution, in the past anyway, previous employees were required to complete the wellness qualifications. Otherwise, there would be no HSA contribution. Now, as new employees, this incentive participate, you do actually, those that started after July 1st are exempt from the wellness qualifications in order to earn the incentive. So for example, as an employee, if you're still within your first 30 days, you may not have selected your health plan yet, but you can select either the low deductible or the high deductible. And if you select the high deductible, you'll receive that health savings account contribution. Even though you're brand new, you haven't had a chance to participate in the well-being program. Also, if you started after July 1st, you get the first year exemption. So when we get to annual enrollment time in May, remember that one time a year when you can change your benefits or change your health plan choices, you will still have access to the low deductible or the health savings account contribution if it is offered next year. So I just wanted to clarify that, that if you did start after July 1st, you're a new employee, you are exempt this year from participating in the wellness program in order to earn the incentive. However, you'll want to always pay attention each year as the well-being program does change, the incentive changes, and you always want to be aware of that so you are on track to be eligible for whatever incentive is available that year. Currently, our health plans are under review. The qualification for earning the incentive for this next year has been determined, but the incentive itself for completing the wellness qualifications has not been determined at this time. Therefore, you'll want to watch your email from the benefits office, watch our nutrition or our benefits bulletin for more information about that. But the important thing for you to remember at this time, if you're hired after July 1, you and your covered spouse are not required to complete the wellness qualifications to earn the incentive. But I do want to go through what those qualifications are because we might have some new employees that actually started prior to July 1st, and this would apply to them in order to be eligible for the incentive. Next slide. So for this current year, the wellness qualification, all that needs to be completed is your health screening, and then you would earn the incentive for fiscal year 22. So as long as you complete an on-site health screening by April 1st, 2021, you would be eligible for the incentive. Both the employee and the covered spouse must complete the health screening in order to be eligible. And as you note on the bottom of the slide, new employees hired or spouses added to the health plan after July 1st, 2020 are not required to complete in order to earn the incentive. And that is only for this year. Starting July 1 of 2021, you will want to find out what the wellness qualifications are and what the incentive will be. Next slide. So even if it's not required for you this year in order to earn the incentive, we highly encourage you to participate in a health screening. The health screening does provide some basic information for you and can be very helpful in knowing your numbers and keeping yourself healthy and on track. Next slide. So what is included in the health screening? We offer these health screenings across the state between the months of July and December. We have several locations in our bigger cities. And what we do is basically in about 15 minutes time, they capture your height, weight, and waist measurement, blood pressure, your cholesterol, including HDL, LDL, triglycerides, and they also get your glucose measured. And the important thing to just know where your numbers are, because you can catch some issues before they become a concern. And it's good just to keep track of that to make sure you're in a healthy range and reduce your risk for any disease or other issues. So there are two options for health screening. You can attend one of those on-site health screening events I mentioned that are at a location near you. As I said, we offer them in many of the cities across South Dakota. Or you can also complete the health care provider form, which is available on our website. There's no cost to either of these screening events, so you can participate in that. If you complete the healthcare provider form, as long as when you go to your healthcare provider, you are doing this as a part of your annual wellness preventive exam, there will be no cost for that as well. In your state health plan, everybody gets one free annual wellness preventive exam. So that's one thing you want to make sure you are aware of is what does your insurance cover at no cost in regard to preventive care? And this is one of those things, annual wellness preventive exam. You'll also want to be aware and do a little research on what other preventive exams are available. Based on your age and your background, you can get other preventive exams at no cost. You can also get some immunizations at no cost. So I encourage you to be aware of your benefits, take advantage of those, and use the opportunity to get your preventive care covered at no cost. So these are your two options for health screenings that you can get your numbers. The great thing about going to your healthcare provider as a part of that free annual wellness preventive exam is they will do these tests, and then your provider can actually talk to you about your results, give you some recommendations, and keep that in your permanent file. Next slide. So where do you go to find information about the Benefit Wellbeing Program, find information about health screenings? Benefit.stable.com is what we call our portal. We have a wellbeing portal. As I mentioned earlier, we partner with a vendor called Staywell to provide this portal. This is where you can access a lot of your wellness information. The portal itself is new this year. So if anybody was with us prior to July, the portal looked a little bit different, and this year it is new. you're not required to earn the incentive. You don't have to go into the portal. You don't have to create an account. You don't have to access the challenges, the resources, but I am going to talk about those today. But if all you really want to do right now is get that health screening completed, see the orange arrow is where you go on that portal homepage. And there's information about the on-site screenings and the healthcare provider form. So without having to log in or create an account, use a password, you can get to the information you need from this home page. And I'll talk more about the other aspects of this portal in just a little bit. Now, when you do click on the health screening, if you want to go to one of our events, you would need to register for that screening event. So when you leave the portal that I just mentioned, it'll take you to the Health Management Partners portal. And as I mentioned earlier, they are one of our vendors as well. They provide the health screening events across the state. You will need to have an account to register. And if you want your spouse to have a health screening, they would need to have their own account. You can log in at this screen. You can create your account at this screen. You either use your health plan ID number or an email address and a password to set up your account. And then it's very simple to search for the city where you want to get a health screening and find a date and time that works for you. Now the healthcare provider form that looks like this, and this is available on our website. I believe that Kim shared earlier, our Bureau of Human Resources website is bhr.sd.gov. I'd encourage you to put that in your favorites and check that periodically because we have various updates out there. But one of the things you'll see right on that bhr.sd.gov page is information about the health screening events, including a link to the healthcare provider form. So you can just click on health screenings and you can get to this form in that way as well. Even as a new employee, since you are not required to complete it this year to earn the incentive, you might still want to complete this form with your healthcare provider and get your numbers and actually submit it, because we will then keep that health data on file and you can kind of track your numbers over time. So current employees would be able to go out and look at their health screening results from last year and compare them to this year and see if you've made progress or if any changes need to be made. Next slide. So if you want to do a little more than just the basic health screening to earn your incentive, we encourage you to go to the benefit.statewell.com portal and sign up. So if you've never been to this portal before, since July 1st, we just rolled out this portal July 1st, you would actually need to sign up first and create an account. Both you and your covered spouse can have access to this portal, but you would each need to have your own accounts. Once you have signed up and followed the process to sign up for the program, then every time you come to this portal login page, you can just log in on the upper right-hand corner. It's very easy to sign up and create an account. It will ask you for your affiliation, and that is basically the agency or the department that you work for. So if you have any questions about that, you can certainly reach out to your supervisor or your agency to make sure that you are picking the right affiliation. The reason we have that is we can have wellness challenges in agencies, and it makes it a little more fun that way. Otherwise, the rest of the information is very to the point, and you should be able to create your account very easily. Next slide. The next step, when you create your account, they're going to ask you if you want to start a team, join a team, let them pick a team for you, or join as a team of one. I encourage you to, especially as a new employee, just sign up as a team of one to begin with. You can always go back out and join a team that might be in your agency or your department or your office, or you can start a team at any time as well. But to get into the system, you can just select team of one to get past this page. The online health assessment is the first thing that will pop up when you get into the account. This health assessment is basically a series of questions that ask you about your health behaviors. In the past, this has been one of the criteria to earn the incentive. It's not this year, but it does help you think about your own health behaviors, and if there are some maybe areas that you might want to work on. It can also trigger specific programs within the portal that might be especially useful for you. So it's a good process just to do a little assessment. Should take less than 10 minutes. Assessment of your current behaviors and think about some of those things. You can choose to complete later at the bottom of the screen. You can click complete later. Otherwise, it'll take you through each page of the assessment. If you choose not to do that at this time, you just click complete later and you can move on to the next page of the portal. Up in the upper right-hand corner of the portal, there are several icons that I want you to be familiar with. So the first one is sync your device. If you have a tracking device that tracks your steps, miles, things like that, you can actually connect that to our portal. And that way all of your information will show up in the portal. If you're doing a step challenge or other challenges, that will automatically sync, which makes it very convenient. There's also the option of direct chatting with one of the Staywell employees. There is a notification icon. The arrows are levels or teams, and if you want to check out your teams or see what teams are available, you can go there. The flag is important, just provides you some help in navigating the site. There's also a tour of the portal that you can do at any time. Typically, when you first log in, it does give you the option to take a tour, but if you want to bypass that at the moment, you can always go back to the flag and watch that tour at any time. And then, of course, the last one is your settings icon. You will want to edit your profile. You can add a photo, you can add your information there just to update your particular account. And here are some of the devices that you can connect. In addition to these, you also can connect Apple devices. There is a specific instructions for that within the portal. And if you need any assistance with that, you can use the chat button to help you connect that device. On the page itself, there are tabs across the top with different topics. There's information on the left column. In the center where the arrow is pointed, these sliders have some of our top and most important information. And you can click on the right arrow or the left arrow to maneuver through the sliders. So that's important to know because we will update these periodically. The healthcare provider form and the health screening, since they are required to earn the incentive, those will always appear here, and then we will update the sliders with other new information such as challenges that are occurring at the time. Next slide. And again, here's the health screening and slider and information that you can click in up in the right-hand corner to actually schedule an appointment right from there. And again, you can click Let's Go and it'll take you directly to the healthcare provider form. So we have lots of different ways to get to the information. We just provide some different options for you. Next slide. One of the sliders right now is promoting mental health podcasts. We have several podcasts out there, I think nearly 15 to 20. Each of them are short 2 to 4 minute podcasts about how you can improve your mental health or address mental health topics. Very good topic issues that you might want to check out and listen to. All right, so looking back at the home page, the dashboard is in the upper left-hand corner, that tab. That's what you see when you first get in. The next slide will show us that the next tab is My Progress. And once you are an employee and you've been here a while, and are required to complete the wellness qualifications to earn the incentive, our portal will always show your progress towards earning that incentive. So it's important for employees that were hired before July 1st or other current employees to make sure that your progress shows that you have completed the health screening if you want to earn the incentive. And as a reminder, all the well-being programs are completely optional. There is no requirement to do a health screening, but that is how we do our incentive program this year. So you'll want to stay on top of that. You also can check your progress on the dashboard. Over on the left-hand side, there's a trophy. That trophy will be marked green all the way across once you've completed the health screening. Notice right below the trophy, go back just one slide, right below the trophy, there is a clipboard that's showing that the health assessment is completely done at this time. Next slide. The next tab is sessions. There are some great topics out here. Every month they open up a new topic and have something new for you to learn. There's short videos, like 2-minute videos, short articles you can read, quizzes, games, different ways to check that learning, and then also an opportunity for you to track your progress towards a goal. So these are really interactive sessions designed to give you a little bit of education and information, and then a tool for you to use to track your progress in improving your health in that way. So this September, our topic is strength. And you can see all previous months as well, but September opened up the strength topic. October 1st, the topic will be fruits and vegetables. And we'll also be doing a fruit and vegetable challenge in October that you can watch for. Next. Here's an example of the one of the modules or sessions. Next slide. Again, you can review the information, you can do an activity, start a quiz or start a game, and then you can try to reach the goal for that topic. Next. Another one, next. And again, this was a fun game that you can quickly play just to learn a little bit more about healthier drink options. Next. And here's where you can track your progress then on any of those session topics. It's a great opportunity just to actually put what you learn to use. Next. The next tab is vitals. So this is your vital information. This is where your health screening would be posted and where you can track your numbers and from year to year. So that's a great tab there just to see where you're at. And you can learn a little bit more about what those numbers mean and how it impacts you. Next. The next tab is challenges. So we have 3 different challenges out there that you can do: steps, strength, and fruit and vegetables. You can actually see on a leaderboard where you stand with others that are also doing the challenge. You can have a team challenge and compete with teams within your department or across state agencies. It makes it kind of fun and motivating. Next. Here's an example of what the step challenge looks like. And I think the next slide will show your progress compared to the leaderboard. And the next tab is My Team. And this will, is where you have an opportunity to join a team or start your own team. And you can track your team progress as well. Next. Now the last tab is resources, and we have tons of resources out on the website. So we have newsletters, we have these topic pieces, we have workouts, nutrition information, recipes. Great opportunity just to check out what we have there and to learn something new. Next. Now, it's encourage you to download the My Stay Well mobile app. You can go to Apple Store or Google Play and download it. There's the icon there. That's what it looks like. That makes it very easy for you to access the challenges and information that we have out there. And you can watch the videos or the sessions as you have time. Okay, now we're going to switch gears a little bit. That was the whole well-being program that's tied to the incentive and our portal, and where we have access to programs, workouts, things like that. Now, the next section I'm going to talk about is specifically with our vendor health management partners. They provide 3 specific programs for all of our employees and covered spouses. This would be our conditions management program, case management program, our healthy baby program. The 800 number listed, you can call them to find out if you qualify. So these are all programs that you need to qualify for based upon your current conditions. Next. The HMP Conditions Management Program is available at no cost to you. In fact, all these programs are available at no cost to you. Health coaches are available to help manage conditions such as asthma, cardiovascular, diabetes, kidney, pain, and others. Active participation in this program can result in incentives such as free office visits, free lab work, and more. So depending on what your condition is and what services are available, you can get some additional incentives. So I really encourage you to consider the conditions management program. They have excellent coaches, and they can help you hopefully stay out of the emergency room and reduce hospital visits, reduce overall healthcare costs for yourself, and improve your health as well. HMP Case Management Services is another service through Health Management Partners. It is a collaborative process between the patient, the healthcare provider, and the patient's family or support network. You are assigned a case manager, which helps you navigate complex medical systems, advocate for the patient, assisting with assessment, evaluation, coordination of a treatment plan. So who is eligible for these services? On the right-hand side of the slide are just some of the eligible case situations: active cancer treatment, transplant evaluations, depression or chemical dependency, traumatic injuries, frequent hospitalizations, high-cost medication or treatments, and neonatal intensive care. And there may be others that aren't on this list. So if you feel like you have medical issues that you end up in the hospital a lot or have frequent and high medical costs, call the 800 number to see if you qualify. They are excellent service providers and really can help you navigate the complex medical systems. All right, our Healthy Baby program, it is individual case management. Want to make sure our employees or their covered spouses are going to have healthy babies and that they follow all the prenatal recommendations. You can receive a first trimester ultrasound and a second trimester ultrasound, lots of educational materials. And in addition, if you participate fully, you can receive up to $500 incentive in a health reimbursement account. So Kim talked about the health reimbursement account earlier. This is one way that you would receive an incentive of $500. You do need to sign up for the program early on in your pregnancy in order to get the full $500. So it's something you should make note of and keep track of if that's something that you think you might benefit from. So that was the Health Management Partners program, and they provide a lot of services just to help keep you healthier and provide that preventive care and assistance. The next program I'm going to talk about is the Employee Assistance Program. This is offered through the state of South Dakota through our vendor called KeyPro. The Employee Assistance Program basically exists to help our employees and your dependents with any issues that might be troubling you or any issues that you need assistance with. We want to make sure our employees are taking care of themselves, taking care of their families, so that when you're at work, you can feel good at work and not have a lot of other issues on your mind. So some of the things that we offer through the Employee Assistance Program are focused counseling and consultation referrals, financial consultation and referral, legal consultation, organizational support services, work-life convenience service, caregiver resources, and daily living convenience services. I'll talk a little bit more about those on the next slide. All right, so one of the things that most of our employees are aware of is the fact that the EAP really provides a great opportunity for focused counseling, consultation, and referrals. So you can get free telephonic or in-person counseling for employees and their dependents. So everything in the Employee Assistance Program is available to the employee and their dependents. Whether you cover your dependents on your health plan or not, they are eligible for this. So if they're eligible for benefits, if you could cover them on your health plan, whether you cover them or not, they are eligible for it. So if you have a child that is dealing with depression, they can get these free counseling services as well. It's important to help our employees address any issues that they might be dealing with. This is just one of the ways that we can do that, and I highly encourage everybody to consider it if it's something that would be helpful for you. Next. We know that financial well-being is an important part of overall well-being, and so we do provide this financial consulting and referral services. We can provide telephonic consultation with a financial professional on issues such as credit issues, tax questions and planning, family budgeting, financial planning, and any of those topics. So you can receive, I believe, up to 30 minutes of free consultation. And then if you need more time with that financial advisor, I believe you can get it at a discounted rate. The next slide will talk about legal consultation, which is very similar. Free 30 minutes in person or telephonic legal consultation, and then a reduction in fees if you choose to retain the attorney. I know people that have used this for divorce issues. Maybe someone else mentioned they used it when they had an issue with their landlord. So, you know, if you just need a little bit of legal advice, maybe you need to plan a will. If you need some legal advice just to get yourself set to make sure you're on the right track or answer a few questions, this is a great service, again, at no cost to you. And then we have organizational support services. So if you are a supervisor or you're the management level, there's consultants available to address issues you might be having with employees regarding absenteeism, work performance, substance abuse, mental health concerns, workplace conflict, and other issues. So it's a nice resource for supervisors or for managers that just need a little bit of direction as to where to go with some employee issues. They do also provide case management of formal and mandatory referrals. They provide assistance to help employees achieve success. And then we also have work life and convenience services. So in the different areas, if your, say, your parent lives in a different state and you need to find elder care for them, KeyPro can provide an opportunity to see what resources are in the area, and they can help you with other things if you're new in the area or if you just are not sure where to turn for certain resources. They have a resource data bank that can be very helpful. And there's also caregiver resources, specifically child care and adult or elder care that can be very useful as well. Next. So how do you access these resources and information? You can go to www.eap, that's Employee Assistance Program, helplink.com. The company code you'll need to enter is South Dakota, all one word. There's also the 800 number there. So on this website, you will also find educational sessions and webinars. You'll find resources. So If you want to, you can check out all the resources first. I'm sure you can find will writing resources out there and some other financial or legal information. And you can access a wealth of information out there. Next. So that is the conclusion of the Benefit Wellbeing Program, which included the benefit.staywell.com portal, as well as the incentive that goes with completing your wellbeing qualifications, the health management partners, and all of their services they provide, as well as the employee assistance program. I thank you for your time. I see if we have any questions.
Let's take a look. There's one in the Q&A. It might be from benefits. Let's see. It was a question about vacation time.
Michelle, I can answer that.
Yeah, it would be great.
So the question is about vacation time. I have heard new employees can't use vacation time for 6 months, but then I have also heard this policy has changed. I just wanted clarification. So that has changed effective of our new fiscal year of July 1, 2020. We have changed it where new employees are allowed to use their accrued vacation leave from their start date instead of waiting the 6-month probationary period.
Okay, it doesn't look like there's any questions related to the well-being program, so I am going to turn it over to Alan.
All right, thank you, Carrie. My name is Alan Frang, and I'm a retirement planner for the South Dakota Retirement System. And I'm going to give you, as it says there, a real brief general overview of the South Dakota Retirement System. I'm assuming that most of you on the call today are fairly new to state government. There might be a few of you who aren't, of course, but I would encourage you beyond this presentation to make sure and hit us up as you're navigating through your career. This is the South Dakota Retirement System is a pretty amazing benefit, and we just want to make sure that you're always informed on everything within the plan. And so this will be pretty brief, and it is very general, but let us know if we can ever be of service. This disclaimer basically says that I can tell you whatever I want and you can't hold me accountable, so I don't really spend much time on that. The South Dakota Retirement System, we're a 401A defined benefit plan, as it says there, with fixed statutory contribution rates. And so we're, as it says, defined benefit. We're not like a defined contribution plan like a 401K, which is a defined contribution. We're defined benefit. And so at retirement, we will define your benefits based off some variables that we'll talk about here in a few minutes. There are 475 employer units that make up the South Dakota Retirement System. The state of South Dakota is just one of the 475. I live in Pierre, and the city of Pierre is one of the 475. The Hughes County is another. Pierre Public Schools is another. And so there's 475 of those across the state of South Dakota that make up the South Dakota Retirement System. So when you go to work for one of those outfits, and you're going to be a permanent full-time employee, then you have to pay into the South Dakota Retirement System. And so we have, as it says there, Class A and Class B members. Depending on your class, you have to contribute a percentage of your salary every pay period. And then your employer has to match that same contribution. And so city employees, county employees, state employees, kindergarten through Board of Regents employees, we're all Class A members, and then the others are Class B public safety. And so law enforcement on the county level, the state level, corrections, firefighters, those individuals would be Class B. They're contributing 8%, and their employers matching that same 8%. We provide lifetime benefits through the South Dakota Retirement System. So again, your benefits will be defined at retirement based on some variables. We'll calculate it, and then we're going to pay you that benefit every month or every year for the rest of your lifetime. We provide a cost of living adjustment to the retirees every year. So every year in July, we pay a cost of living allowance to the retirees. We've paid a raise every year since 1974. And we also provide survivor, family, and disability benefits at little or no cost to the membership. Next slide, please. So when you go to work for one of the 475 employer units, and you're going to work 20 hours a week or more on average over a 6-month period, then you have to pay into the South Dakota Retirement System. So It doesn't matter if you work 20 hours a week or you work 100 hours a week, you're getting credit for the same amount of service. And then it takes 3 years to be vested in our system and be eligible for a lifetime benefit down the road at a appropriate retirement age. And so 3 years vesting period with the South Dakota retirement system. Next slide, please. We have two different structures of benefits within the South Dakota retirement system. It doesn't matter if you're Class A or Class B or either a foundational or a generational member. So if your service started prior to July 1st, your first paycheck, I should say, came in prior to July 1st of 2017, you are known as a foundational member. And if your first contribution ever to our system came in after July 1st of 2017, you are known as a generational member. Okay, so you're either a foundational member or a generational member, and you're either Class A or Class B. Here are some of the differences with retirement ages for both generational and foundational on the Class A side. So normal retirement is 65 and 67 respectively. Then benefits can begin as early as age 55 on the foundational side and 57 on the generational side. If you're drawing benefits before your full age, there's a 3% and 5% reduction, depending on, again, if you're foundational or generational. The foundational members have the rule of 85. That's when their years of service and their age total 85 points. They can retire before that age 65 without a reduction or without a penalty. You'll notice that there is not a special early retirement date on the generational side, but they do have a variable rate retirement account, which I'll talk more about here in a few slides. Next slide, please. We do pay family and survivor benefits, so there's no additional contributions needed. If you pass away as an active member and you leave behind children under the age of 19, minor children, we're going to pay those minor children 25% of your salary until the youngest child turns 19. And the key is that it's the 25% is split amongst your children under the age of 19. So if you have 3 kids under the age of 19, you pass away as an active member, 25% goes out. When your oldest child turns 19, the 25% still goes out, but it goes out for the benefit of the 2 children under the age of 19. And then when your middle child turns 19, the 25% would still go out, but it would go out for the benefit of junior, and we would pay that 25% until your youngest child turned 19. And then once the youngest child would turn 19, this benefit would stop. If you did leave behind a surviving spouse, they'll be eligible for a retirement benefit down the road at either 65 or 67, depending on whether or not you were foundational or generational. Next slide, please. We do pay disability benefits. We have probably close to 500 members who are receiving a disability benefit right now. And so my advice to you would be that hopefully you'll have a nice, long, happy career and won't have to make a phone call. But statistically, it looks like about probably 5 of us are going to have to, at some point, probably go on disability based on what the statistics are right now. And so if you have a sickness or an ailment, I would encourage you to call our office. There's a couple people who handle our disability cases. They're very, very sweet individuals who have a really difficult job every day dealing with people who are in tough situations, but they'll take very, very good care of you. Names are Laurel Burke and Sarah Edie. But there's eligibility requirements. It's confidential. We're not going to call your employer and say, hey, did you hear Alan hurt himself and he's thinking about maybe quitting you guys and going on disability. It doesn't work that way. And then the last thing I would say is that the disability benefits through our system do not affect what Social Security might be paying for disability benefits. So the best thing to do is, again, if you have a sickness or an ailment down the road, just give our office a call and we'll put you on the phone with the right people and look at what you have for options available to you. Next slide. We go around the state and we educate our membership as much as we possibly can. Things are a little different right now with the whole COVID situation. We're not traveling, we're doing everything virtually, but it's looking like starting the 1st of January, we're going to go back to being out on the road, and we go around and we do lots of educational things for our membership. And so when we're going to be in your neck of the woods, we will send out a postcard letting you know of our pending arrival. You can call, you can go on the website, you can register for events. But this is only your future we're talking about, so it's a pretty big deal, and I would encourage you to take as you know, as many times as you can, take advantage of workshops and things that we're putting on for you, because again, it's about your retirement. It's a big deal. And so don't be afraid to come as often as you want and educate yourself on your South Dakota retirement system benefits. Next slide. Here's our contact information. And so we're located in Pierre. We're a block west of the Capitol. Our front door faces east. Ordinarily, you don't have to have an appointment to come in and see us, but with COVID going on, we just ask that you call and make an appointment in advance. Even if probably if you didn't make a call, we'd still let you in the door. But best right now, if you can just call ahead, let us know you want to come in and see us, and we'll make that happen for you. I think this is my last slide for the SDRS portion. And I know I mentioned that variable rate retirement account. And I know that there's probably more people on the call today who are pretty new and that are foundational members. And so I thought I had a slide pertaining to the variable rate retirement account, but I don't, but I want to mention it. So you generational members also have that variable rate retirement account, which it showed there, and the differences in the two structures of benefits. That's a pretty neat benefit for you generational members. Every year, we're going to put 1.5% of your salary into that variable rate retirement account. And it's going to be managed by us and the South Dakota Investment Council. And so we'll make the contribution for you. So you don't make any contribution to that, and your employer does not match that. We make the contribution of 1.5%, and then it's being invested for you throughout your career. When you get to retirement, we'll pay it out to you. If you become disabled, we'll pay it out to you. And then if you would actually pass away while you're an active member, we would pay out those dollars to your beneficiaries. And so you generational members sort of have a hybrid retirement plan. It's mostly going to be defined benefit, where we calculate that lifetime benefit for you, and you'll get that forever. And then you'll also have a sliver of this other benefit that won't be lifetime income, but we'll pay you. Pay it out to you at the time you retire, and it'll be a nice chunk of money that you can use to help offset some of the costs that you might have as a generational member. Next slide. So the supplemental retirement plan is also a plan for the South Dakota retirement system. It's our way of offering you another way to save additional dollars. And so the supplemental retirement plan is run by Nationwide. The IRS will not let us manage our own supplemental retirement plan. It's got to be done by a third party. And since 1987, Nationwide has held the contract for us. Next slide. So it's a 457 plan, cousin to a 401k. It's available to all members. No penalty for distribution before 59.5. So it's not like a traditional IRA or a 401k. You can access the dollars before 59.5 with no penalty. You just can't be working for the state of South Dakota anymore when you pull the money out. You can do before tax and after tax contributions. And Matt Clark and the staff at the South Dakota Investment Council, they do not manage the money, but he does choose our investment options for us every year. And then we do have two ladies in Pierre who run the plan for us. Their names are June Larson and Ginny Lorsch. They're in the same building as us, but they are employees of Nationwide. They're paid by Nationwide, but they're paid only on salary, and they'll do a really, really good job for you. They're not looking out for their own interests. They're looking out for yours. They get paid the same whether you participate or not. Next slide. So enrollment is easy. Actually, for state employees now, you're automatically enrolled into the supplemental retirement plan. You can start, stop, raise, lower whenever you want to. $25 a month is the minimum. If you're under the age of 50, $19,500 is the maximum for the year. If you're over 50, they do allow for catch-up provisions, and then the asset management fee is 0.16%. So it's $16 for every $10,000 you have in the plan is what it would cost you annually for them to manage your money. Next slide. Withdrawal options, again, you can take money out once you get to retirement, or if you just quit your job working for the state, you can pull your money out without penalty. They also allow for you to take, if you have an emergency, so they allow for unforeseeable emergencies where you can sometimes access your dollars if you truly have an emergency. Next slide. The Roth option, so you can make after-tax contributions. When you're automatically enrolled, you're making pre-tax contributions, but if you want to make Roth contributions, you can make after-tax contributions to the supplemental retirement plan. Next slide. Here's the contact information for the supplemental retirement plan. I would call the local number 224-2230. That is the peer office number, as it says there. The 800 number is for customer service at Nationwide in Ohio. They're actually in the same building as us. So they're in the SAR building here in Pierre, a block west of the Capitol. They share the same building, but they have their own office entrance. And then there's their website information. They have a great website, srp457.com. Next slide.
I think we're at the end, Ellen.
Okay. Any questions?
And at this point, it doesn't look like we do have any, but here's the information, at least for the supplemental retirement. Alan also shared the information for his office. This presentation will be recorded, so you'll be able to access it on the BHR website. There's also a PDF available, so if you need these numbers, those will be on the PDF, both the website and the phone numbers to contact Alan and his folks. If you have any questions that come up after the presentation. Other than that, I want to thank Alan and Jade and Carrie and Kim and Mandy for another presentation this month. Feel free to reach out to BHR if you have any additional questions, like I said, via the website to access the recording of this or the PDF, or just simply reach out to BHR for any questions at all. And as I'm talking, there, it looks like there's one. Let's see what it is. Oh, this is for Alan. Are you still with us, Alan?
I am.
The question is, for the supplemental, can you adjust how much you want to place into that account through the website provided on the supplemental slide?
So that's a great question. You cannot change your contribution amounts on the web page yet. There's trying to sort out some information with electronic signatures. You can change your investment options online, but you cannot change your contributions amounts. And so if you just call 224-2230 and tell June or Ginny what you want to do, they'll do the paperwork for you, scan it and email it over to you. You can sign it, send it back, and that's all it takes to make a change to your contribution. You can change your contribution one time per month.
Okay. I thought maybe if we had a little bit more time, we might see. Oh, here we go. Here is another one. I haven't received my South Dakota Retirement System membership ID card yet. How long does that take?
It should take usually about within 2 to 3 months. You should get it. So if you haven't gotten it, I would just call our office and let them know, and they can send it out to you. But a lot of times, employees have been working for darn near a month before we even start to get their paperwork from their employer that they even exist, essentially. And so, hang in there. If you get concerned about it, you can just give us a call, and we'll give you your information and send it out to you, all that good stuff. But usually, it comes along. It might take a little bit to get it going, but always give us a call, and we'll get it adjusted and sent out for you.
Okay, I'm going to wait about 1 more minute just because we do have some time left. So let me wait about 1 more minute if we do have any additional questions pop up. Otherwise, we will we'll end our presentation here in about a minute. Minute always seems like a whole lot of time when there's dead air. That's for sure. All right, well, thanks again, everyone, for participating. And thank you, all of our panelists, for helping us out with this presentation. And we will go ahead and end this. Thanks so much. Oh, wait. Just before I ended it, I had one come in. Alan, did you leave me yet? Okay.